Hello, good day. This is Paula, and I'm traveling from Manila once again. And since this is already my second visit, I think I visited last four months ago, and it has been really wonderful since then. I remember I had a few procedures done, which were Ulthera, Botox, and filler, and it was very good. The effects were long lasting, and even until now the effects are still very good. And I'm here once again for my second visit to achieve a more ideal V shape. Stay tuned and don't change your channel.
Good day, everyone. Welcome to the Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. In today's episode, we have a follow-up from one of our previous guests. She's here to share with us the post-treatment, specifically the correction of the facial asymmetry using the combination Botox fillers, threads, and therapy. Let us all welcome Miss Paula Maravilla.
Hello, hi everyone.
Welcome, Paula.
It's good to be back here.
So we're happy to see you again. So it was like 4 months ago, right?
Yes.
Yeah, when we did those poking into the lower third of the face, making use of that Botox on one side, Ulthera on one side, and a thread on the other side,
yes.
And the filler also. Okay, so how was it? If you can share it with our televiewers, like after that treatment, so the days after that, so what did you feel and what did you notice?
The effects, Doc, are super good.
Yes.
I mean, I could really see that my face is more defined and contoured.
Right.
And I already have more balance in my face,
Right.
which is what I really want to achieve from the start.
Yes,
And
exactly.
I didn't expect for the effects to be that fast.
Right.
Because it's really long lasting. Because even until now, my face is
can
much,
appreciate
yes, it's much
Right.
more defined and contoured and balanced.
Yes. Actually, Paula, beauty is balance, beauty is harmony. So, the right proportions, the right symmetry, it gives us beauty.
Yes.
Okay? Normally, okay, para sa ating mga ka-CSA din, ang mukha po talaga natin, meron yung tinatawag talaga na asymmetry. So, may mga iba, isang side mas malaki kaysa sa kabila. Even sa eyes, manonotice mo may mga tao na mas singkit ang kabila compared sa other side or wider and bigger ang isang side na mata than the other side. And titingnan mo rin yung iba yung sa yung cheeks, yung sa pisngi. Merong iba mas bulge or mas chubby ang kabila compared to the other side. So, meron din po talaga tayong tinatawag na facial asymmetry. Kasi may mga ginawa ngang studies yung sa symmetry ng face.
Yeah.
Pag inaaral nila yan, meron talagang isang side na mas dominant or mas malaki compared sa kabilang side. But then, we wanted naman yung asymmetry na yon, yung hindi ganon ka-obvious.
Yes.
So, somehow, you try to balance yung isang side doon sa kabilang side. So, we wanted to project yung magandang harmony and balance to the face.
Yes.
And good thing naman, dun sa mga procedures that we have done for Miss Paula, actually, I could say, those were just partial treatments So, we wanted to complete it.
Yes.
And right now kasi, the ideal face shape, okay, where most of the ladies are craving about, the ideal face shape is the V shape. V face shape or the inverted triangle, right?
That's also what I've always wanted,
To achieve, kahit ako. Kasi nga, as time passes by, nagkakaroon ng tumatanda, nag-age, and right now with our lifestyle, it's like an accelerated aging. We have a fast-paced life, lahat nagmamadali, and because of this, pati ang aging process parang nahihasten.
Yes.
But with our technology, with science, with aesthetics, we can delay the aging process. So making use of natural procedures, non-surgical techniques, kasi ako rin, I don't want any
Yes.
procedure na may paghiwa or mahabang downtime.
Yes.
So mabilis nga ang ano ngayon
Super
eh.
fast
Ang
lang.
buhay natin
Yeah.
ngayon eh. So we wanted something with fast recovery also.
Yes.
So right now with Miss Paula, we wanted to do a continuation of that treatment to achieve that V-shaped face. Actually, we wanted to do yung sa chin part. I think the last time na we did the treatment, I mentioned, we still wanted to correct pa yung portion na meron pang, what do you call this, or kulang pa, or parang may volume deficit pa, or kailangan mo pang i-shape, or kailangan mo pang bigyan ng mas magandang contour and definition for the chin part. Kasi if you wanted to have an ideal V-shaped face, unang-una, you should have a very good OG curve ng cheek or the sexy curve S-curve. And then after that, you taper here and go to the chin. You should have a very good
Yes.
chin projection, a very good chin shape. It creates beauty, balance, and harmony. So
Yes.
that's what we're gonna do for Miss Paula right now. We will be using our Juvederm Voluma for the chin enhancement sa pagbabalik ng CSA Certified Skin Authority. And we're back mga ka-CSA. So we are now at the actual procedure for the chin enhancement for Miss Paula to achieve the ideal V shape of our face. So with our procedure, we will be following the so-called MB codes for chin enhancement. We have the Juvederm portfolio. Actually, the products for Juvederm dermal fillers, they're made of hyaluronic fillers. We have two lines, Hyalocross and Vicross. And right now, we use the Vicross, which means to say, yung mga particles po nandoon, meron silang cross-linking para stable sila and longer lasting. So when we do the procedure for the chin enhancement, we make measurements also plus surface land markings, okay? So ideal kasi sa face natin, when we do a check-up, we do face mapping, upper third, 1/3 dito, and then the middle third, and then our lower third. So sa lower third, that includes your chin part, okay? So when we do a markings kasi, 1/3 division po ng ating mukha. And then this one po, sa ating chin area, we make the chin enhancement, okay? So we have female client, we have Miss Paula here. We will follow the female contour of chin. Okay. So ang aming chin codes po, like I make also a marking on the center po, this one here. So this is a delineation na ang ating mentalis muscle ay ito po. And then, anatomically speaking, meron po tayong tinatawag na mental foramen here, ka-align po ng supraorbital foramen, infraorbital foramen, ka-line po ng medial limbus ng pupil natin. Okay, diretso lang po yan. That's where we find yung mental foramen na sinasabi. Why ko po minimension ito? Kasi importante po yung alam natin yung mga vital structures na iniiwasan when we do dermal filler injection. That's why kailangan po magtungo lamang talaga sa mga certified aesthetic physicians who are trained to do injections like this. Meron pong mga magiging problem pag nagtungo tayo sa mga hindi doktor. Okay? So, kailangan po naiiwasan yung mga vital structures dahil merong mga, for example, dito po, may lumalabas na mga blood vessels as well as nerve. So, yun yung tinatawag nating this one, mental foramen or mentalis foramen. Andito yung ating mentalis muscle. Okay, now what I do kasi, we assess, like ito po, minsan meron yung mga malalalim ang tinatawag na labiomental area. This is the labiomental crease. Sa chin code po namin, this is the chin 1 that we do here. And actually, we have to check yung chin projection ni Paula. We'll make yung E-line na tinatawag. Meron tayong stick. Okay? So, I'll borrow the stick first po. So, we have to align. Ito yung tinatawag na E-line po. Yung tip ng ilong up to the lower lip. Ngayon po, pag pumasok yung chin niya dito sa line na to, then we have a good chin projection. But then with Paula, there's a recession. Naka-recede yung lower, yung chin area. Okay? So, we have to correct this. Kailangan nating gawa ng so-called chin projection. We'll make a forward projection po dito. So, this part here na po is part of the chin code number 2. Okay? And then, sa sides po, if we want to make a rounded, well-defined chin, we have the chin number 3. And then, sa ilalim, so some of our patients, we do chin elongation para talagang V-shape. Yung dito, sa inferior, we also inject a filler here, chin number 4, to rotate it anteriorly or make it more forward and elongate for a V-shape. For male contour na chin po, we add up here. Kasi for men, it has to be wider, broader. Pag dito sa lalaki, we add here. Now, for some of my patients, pag merong tinatawag na pre-jowl sulcus here, we do the chin number 6. Yan po. So, these are landmarkings po where we're gonna do our filler injection. Now, for Miss Paula, I'm gonna correct yung dito sa may chin number 2 niya, as well as chin number 4, and also inject dito sa chin number 3, both sides. Okay, ang concern ni Paula before was the facial asymmetry, right?
Yes.
If you're gonna notice, parang there's a slant here, less of a volume here. So, I need to correct this part, the left side. So, I'll be giving her also volumization here using my dermal filler voluma to correct this lack of substance or lack of definition here. So, we're gonna do, kasi we have patients whom we do also the so-called puppet line or the so-called marionette line. So, this is my surface landmarking. Okay, so inject here, 1, 2, 3, 4, and then this one here. We'll give volumization. So, the filler that we're gonna use will be the Voluma Juvederm. Okay, it's a Vicross technology po, made of hyaluronic fillers, and we know hyaluronic is a natural substance. It's a natural compound you find in your system, in your skin, in your connective tissues. Okay, before I start the procedure, do you have any questions, Paula?
No naman, Doc. Kasi anyway, I trust you and
Paula. Yes, Paula.
all your work is wonderful.
Yes. And of course, we want the procedure, again, we're doing non-surgical. We want a natural result, something na, of course, we don't want any long downtime. Kasi Paula is also busy, okay, still doing that teaching things.
Yes.
Okay, so she works a lot, okay, and also into workouts or
Yes,
sa
workouts.
gym, yan. Healthy lifestyle. And I was looking at Paula, she's so baby, she's so young looking, she's able to
Thank
maintain
you. Because
her
of you, Doc.
natural beauty.
Because
Yan
of
naman po.
Doctor.
And I was even telling her, no need for makeup talaga.
Thank you.
Okay, so as a review again, we're gonna correct yung sa E-line niya. So we lack anterior projection, and we lack yung inferior elongation, and we also lack substance or volume here on the left side. That's the correction we're gonna do. So we will be injecting using my Juvederm Voluma. So we have our products right now. We will be using Voluma also. Okay, and the good thing with the Voluma, it has already lidocaine with it.
Okay.
So meron na siyang pang numb. A while ago, they did already numbing cream. Okay, so let's clean the area. Okay, it's very important to do asepsis and antisepsis. Okay, so we have a product here which is very good, and this is US FDA approved. Importante po yung safety ng every material that we use in our center. And it's important to also know the anatomical landmarks, where to inject, how to inject, and for us to achieve a best natural result. Okay, so ideally, okay, I have my patient in an upright, semi-upright position. Okay, ayan po. So, importante lang yung linis po. And then, I'll start with using a needle technique. Actually, the labiomental crease is fine. So, chin 1, we don't need to correct. It's not really that very sunken or very depressed. I just need to correct yung dito sa may center of the chin area. So, this is just an easy technique. I can actually use my non-dominant hand to inject, and inject here like this anteriorly. Okay. And then, when we do it, you just insert the full length of the needle. And then in my practice, I really aspirate before I inject the filler to make sure that I'm not in a vessel. Okay, I don't have any sign of like I'm in a vessel. Okay, so I'll be pushing already here. So in terms of the number of volume or the amount, how many ml, it's variable. It's a case-to-case basis. So it will depend on the need of the patient. Like for example, I can give like as much as 0.3 to 0.4 on this anterior chin area, okay? So somehow you will be seeing some elevation already. Yan, parang umaangat na rin siya. And I'm using Voluma. It's a very good dermal filler. Okay, top of the line na dermal filler. Ayan. I can see already a projection here. So, anteriorly, ayan po, nadi-define na siya. And later on, we're gonna check with our E-line kung pumasok na siya. And if we need to add more, we'll just add more. So, this is my anterior projection. I also want to give a V shape for Paula here. So, I'll correct inferior aspect. And this is also injecting like this, okay, with my non-dominant hand. Okay, and when I inject, slow lang po. So, with this part, we try to reach for the bone area. Okay, actually, I already feel some augmentation already. And then I aspirate. So, no blood in the hub. And then push a little bit. Okay, push lang po tayo. So, this is to elongate. And then, I'll just inject a little bit lang, 0.2. Because I've used 0.4 a while ago and I use now 0.2. Okay, so there's already a good projection making use of the chin code technique. Okay, so ating pang ipagpapatuloy yung sa ibang parts sa pagbabalik ng CSA Certified Skin Authority. Back mga ka-CSA. So we are continuing with our chin enhancement for Miss Paula. Okay, again, I'm using the Juvederm Voluma. Okay. So a while ago, we did already for the MD codes on chin enhancement. We did the number 2, code number 2, and then I did the code number 4. So looking at her chin, so meron tayong volume dito. So meron tayong contour dito. So, on the left side, there's a less of the volume. Less ang laman dito, Miss Paula. So, what we're gonna do na lang is to correct yung defect here. So, yung code number 3 here, I'm gonna be injecting and then dito sa may parang depression here, we're gonna give you the voluma, okay? So, I already made use of 0.7 ml already of the voluma. And actually, this is a hyaluronic. It attracts water. It is hydrophilic. It still can absorb water. So, as time passes by, you're still gonna see improvement with it. So, habang matagal, basta drink a lot of water and lalo pang nagko-contour and nag-shape ang ating chin. So, let's do the number 3. Cotton with alcohol, please. So, again here, the aspect here. So, as physicians, what we're trying to avoid are blood vessels, okay? So, take note lang po, mayroong facial artery dyan and it's branching towards here, meron siyang inferior labial artery. That's why here po, we're also careful in giving the filler. So, when we inject, so I'll use my non-dominant hand and also pushing here. Okay. So, I can do this movement here para ma-lessen yung discomfort from the injection. And it's my technique or my practice to aspirate to make sure I'm not in a blood vessel, okay? And I can push some of my 0.3. Actually, we're gonna be using more than 1 ml for Paula here. So this is already pushing my 0.3. Okay, how do you feel, Paula? Okay lang.
Good.
Yeah, so this is my needle technique. Okay, so actually, some clinics also use cannula technique. We can do combination, but for this part, we can make use also of our needle. Ayan. So this is a 0.3, and we need 1 more voluma for Miss Paula. I like the filler of the Juvederm because actually we can mold it and we can contour it and we can shape it. Okay, so again, this is a gel. It's made of a gel. Hyaluronic fillers, They're in a gel form. Okay. They're viscous. And this is made of a thick, it's a large size particle gel. Okay. So the good thing with Juvederm, they were able to stabilize the filler gel. Okay. So medyo meron lang pong pinpoint bleeding. Okay. So that's expected po. Whenever we're injecting, making use of our needles, we really expect some bleeding there. Okay. So, wala na. We'll move on to the part here, code number 6. So, our MD code. How do you feel?
Very good.
Okay lang.
Wow, your hand is so light. I cannot even feel any pain.
As much as possible, we want to have a painless procedure. Although I know the pricking of the needle, sometimes you feel it talaga eh.
But this
Right.
yun
It's okay lang, right?
Mm.
So I'm still trying to balance on the right side to the left side. Okay, so I can see a better definition here. Kasi parang this side really lacks volume. So I'm gonna go on this, it's so-called pre-jowl sulcus. I'll make you turn to this side. Okay, yan. Towards me. So I'm adding voluma. I did use already 1 ml syringe. Now I need to add more. So it's a case-to-case basis. How many ml do I need? So it will depend on the physician to evaluate every client. Okay. Siyempre, you have to harmonize everything, balance everything. Okay, cotton with alcohol, please. So this is part of our correction also of the marionette line and correction of the pre-jowl sulcus. Okay. So I'm just gonna be injecting here. Okay, inhale, exhale. Mandible bone. Okay, I can feel bone already, and then I'll aspirate and making sure that I'm not in any blood vessel, and I can push. Like I can push 0.3 or 0.2. When I already see some elevation or parang pag-lift, pag-angat, then I could stop already. So this is our voluma, and we're following the MD codes for the Juvederm. So this is just a needle technique. Okay, I did inject 0.3. 0.3. Yeah. So how did you feel? So far, so good.
So far, so good, Doc. Talaga parang wala lang.
Yeah.
Very good. Very
So,
good.
a lot
Very
better here. Yeah. A lot better here. So, this is the time when we can do balancing. Ayan. So, I can still check. Okay. I can still add more here. A little bit here pa. Probably around 0.2. So, the good thing is that we have this guideline to follow for our dermal filler injections. Okay, a little bit here pa. Cotton with alcohol, please. So, a little bit of a dent here pa, oh. And then, so, another prick here, and then up to the bone. Okay, and I need to aspirate, checking if there's any presence of blood. Okay, wala. So I push. I can give as much as 0.2. So these dermal fillers are beautiful products, and it's gonna help our face for rejuvenation and contouring and face reshaping and a lot better. See that? So ang problem kasi ni Paula before was the asymmetry.
Yes.
And I really noticed a big change. Kasi yung dito niya, lumiit na. I remember this side. Diba we did Botox?
Yes.
We did Ulthera here.
Ulthera.
And also some threads.
Yes.
We wanted to minimize this side here, the right side. Kasi doon sa kabila, sa left side, there was more of volume. Okay, so this was less
Yeah.
prominent. And I noticed na nagkaroon na ng
Shape.
symmetry,
Yes.
nagkaroon na ng shape. Okay, and with our chin correction, you were able to also correct that face asymmetry. And we're trying to give her the V shape also. Now looking at her, we can see and notice a lot of changes. We have done the chin enhancement using the Juvederm Voluma. So right now, we can assess, we do again yung E-line,
Yes.
yung check natin, okay? So the stick that we have here, yung tip of the nose and then the lower lip, and then yung ating chin is already reaching that E-line. So we have done an anterior projection of our chin. No? Sa
Yes.
E-line, pumasok na yung chin part natin. Okay? Kasi nga, dapat meron tayong good chin projection to give us that good chin shape. Okay? To create a beauty and balance and contour sa ating mukha. So, let us now show to Paula itong ating result ng kanyang chin enhancement.
Wow! Oh my gosh!
Yeah.
Ayan, ganda!
Right. Yes.
Nag-V yung mukha ko,
Right.
Doc. It's so
So,
beautiful.
Exactly. And yan Paula, tingnan mo. So, E-line, no? Kanina, hindi siya pumasok dun sa line. There's a chin recession. Now, we have done a very good chin projection. It is a smooth contour.
Yes.
Okay?
Yes,
There's a
Doc.
smoothness there. Looks natural. And I was able to volumize the left side here. So, what I only did, following the MD codes for chin enhancement, yung I only injected the filler here dito to sa code number 2, and then code number 4, left code number 3, and the left code number 6. Okay, so the total voluma we have used is about 2 ml or 2 syringes, equivalent to 1 box of the Juvederm Voluma. Okay, so now we have given a very good
Wow,
V-shaped
thank you,
face,
Doc.
and we have done a balance and a proportion and yung harmony, symmetry sa face ni Paula. So, any questions?
Very happy. So, Doc, how do I maintain the
V-shaped
yes.
thing.
Also,
Okay.
how long?
Will it last?
Yes.
Okay. Now, they did a study on the Juvederm Voluma. Okay, they were saying that it can last 24 months or 2 years.
Wow.
Okay. Now, after this procedure, just do ice compress in the area. Okay. Wala namang mga ibang bawal or
Wala namang
complications
complications, Doc.
after this. None. So, this is a totally safe procedure that we have done for you.
Thank you,
Yes.
Doc. It's so beautiful.
So we did the V-shaped face,
Yes,
chin projection.
Thank you so much.
You're very much welcome. I love
Thank you.
Paula so much. She's so
Thank
dear to
you.
me. Okay,
Yes.
she's a wonderful young lady.
You as well, Doc. As in, you're my favorite doctor na talaga. As in, forever.
Maraming salamat po. Okay.
Thank you.
So, would you wanna have some message to our televiewers?
Yes, everyone, thank you so much, Dr. Contessa, for
You're welcome.
having me here again in your clinic and for giving me a really nice, ideal V shape. So for everyone who's thinking of having done it again, go to Dr. Contessa. I really trust her, and you will have no worries, and you will have a more beautiful face talaga.
Yeah.
Thank you.
Tsaka maganda yung contour ng mukha niya ngayon.
Yes.
Okay. So, confident
Yes.
si Ma'am Paula.
Yes.
Kasi before, di ba, we have some yung mga insecurities
Yes.
before na medyo yun nga isang side compared sa kabila.
Yes.
Merong asymmetry. It's really obvious. We're trying to cover it up with our hair.
Yes.
So, you
Now I
can
can
show.
really-
Okay, ang ganda na ng projection ng kanyang chin. Okay, so beauty with confidence.
Yes.
Ganun ba yun?
Yes.
Anong tawag nila doon? Becoming more beautiful with the heart, something like
Yes.
that. Okay, so thank you.
Thank you,
Ma'am
Doc.
Paula.
Thank you so
Okay,
much.
so salamat din for sharing yung naging experience
Yes,
mo
of
doon
course.
sa nakaraan.
It's
so
my
again,
pleasure.
we guarantee you of the safety
Yes.
of all the procedures that we are doing here, the effectiveness.
Yes.
At the same time, they're US FDA approved po Meron silang mga scientific studies or evidences to back up their safety, clinical safety and effectiveness. Okay, so kung meron po kayong katanungan, you may email me at csaskinclinic@yahoo.com. Our clinic is located here at the second floor of the Pure Gold Dao Building, Dao MacArthur Highway, Mabalacat, Pampanga. Our contact numbers 045-331-1117 or 0933-860-9193 or 0917-504-4268. I also have my FB page, CSA Derm Centre, my FB messengers, Contessa Salvador Alapag. We have our website, www.csadermcentre.com, my Instagram, doc_Contessa. And our the other videos, if you have missed them, you can check them at our YouTube channel. Only type Contessa Salvador, and please do not forget to click like and subscribe as well. So maraming salamat po sa inyong lahat.
Thank you.
And yes, so God bless.
Thank you. God bless you
all
too,
po.
pa.
So when it comes to natural beauty, you can trust the CSA Certified Skin Authority.